Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. These are some of the highlights of this hour. Taraba State Government takes steps to flatten the COVID-19 curve, approves 22 billion naira relief package. Physically challenged in Yobe gets food palliative as state government plans relief package for 22,000 vulnerable households across 17 local government areas in the state. And Mozambican president announces another 30-day emergency from Friday midnight in a bid to limit the spread of COVID-19. The Nigeria Center for Disease Control (NCDC) reported 457 new confirmed cases in Nigeria in 20 states and the Federal Capital Territory. Till date, 44,890 cases have been confirmed, 32,165 cases have been discharged, and 927 deaths have been recorded in 36 states and the Federal Capital Territory. The 457 new cases are reported from 20 states, Lagos with 137, the FCT 76, Plateau 40 cases, 35 in Rivers, 34 in Enugu State, Oyo recorded 25 cases, 23 in Abia, 12 in Delta, 11 in Ebonyi, another 11 in Edo State. Cross River State recorded 10 cases, so also did Kwara, 9 in Kaduna, 7 in Anambra, 5 in Ogun, 3 each in Bauchi, Imo State, while 2 cases were recorded each in Nasarawa and Osun State, and 1 each in Ekiti and Kano State. While the total active cases in the country stands at 11,798. Let's look at the top 5 states with cases being managed at the treatment centers. The FCT has the highest number with 2,908 cases, followed by Lagos, 2,253. Oyo is next with 1,375. Plateau is in 4th place with 665 cases, and you have Ondo in 5th place with 565. In the meantime, the country's daily fatality toll increased to its highest in close to 2 weeks, with 17 new deaths on Wednesday. So far, 927 people have been lost due to the SARS-CoV-2 virus in Nigeria. In the meantime, the NCDC has added a new lab with capacity to test for COVID-19 to its NCDC molecular laboratory network. The General Sani Abacha State Specialist Hospital, Yobe, now brings the number of laboratories to test for COVID-19 in Nigeria to 62, and it's spread across 32 states, including the FCT. If you take a closer look at the breakdown of the molecular laboratory network, you'll see that while some states have up to 5, like Lagos, Kano, even more than that, a few other states like Sokoto, Katsina, Jigawa, Borno, Akwa Ibom, and others have 1 each. We also have the Gene Expert Labs. They've also been activated in states like the FCT, Kaduna, Cross River, Plateau, Nasarawa, Imo, Abia, several other states. But it leaves Kebbi, states like Kebbi, Niger, Zamfara, Taraba, and Bayelsa states having to depend on neighboring states for testing. The Taraba State Government has allocated over 22 billion naira as response fund for COVID-19 in its reviewed 2020 budget of 215 billion naira due to the economic effect of the pandemic in the state. The new budget, which stands at 176 billion naira, will cater to providing PPEs, treatment of patients, and establishment of additional isolation centers if need be.
The COVID-19 response has taken 22,231,687,513 naira 0 kobo, 12.60% of the total expenditure of the revised budget size, and it cuts across sector bordering on crisis, recovery, mitigation, livelihood, and palliative. As we are aware, the Taraba State government appropriated the sum of 215 billion 823 million 576,810 naira 0 kobo for the 2020 fiscal year. The amount is now trimmed down to 176 billion 616 million 318,475 naira 0 kobo in response to COVID-19 pandemic.
However, despite the trimming of the budget downwards to tackle the effect of the coronavirus, the declaration by the NCDC that the state, for the first time since the outbreak on the 4th of August, recorded 4 deaths has raised some fears among residents.
I'm afraid there's fear in the state already since the break of the news. People are expressing fear. People are running here and there. In fact, if you go out now, you discover, particularly Jalingo, the state capital, is almost empty. So for some of us who have been up and doing for the cause of COVID-19, we saw it coming because I think the people of the state, they broke the protocol completely. If you go to banks, you see people. You go to market, you see people. People are not observing the protocol in the state. We saw it coming. Even though there was this large celebration that no death has been recorded in the state. But for some of us who have been watching the activities closely, we will know that very soon something like that will happen. We only call on the state to make sure, to ensure that the people of the state are following the protocol. If not, things are being left. And we also urge the committee on COVID-19 in the state to step up their efforts.
Over in Yobe State, the governor, Mai Mala Buni, says his administration is targeting 20,000 vulnerable households that have been affected by the pandemic, and this is across the 17 local government councils of the state. He made the disclosure in Damaturu while flagging off distribution of food palliatives to hundreds of physically challenged persons donated by the Coalition Against COVID-19, a private sector initiative.
The angels for supporting the Western government with these palliatives, and it has come to the right time because the resident is just settling down. So most people are running out of foodstuff. So this one will complement their shortages.
Today we are launching the flag-off ceremony of COVID. COVID is Coalition Against COVID. A conglomerate of private sector individuals come together to support the government of Nigeria. And our part of the contribution has reached Yobe a few weeks ago. And today, in the presence of His Excellency, the Executive Governor of Yobe State, and the COVID team from Abuja, we flag up the distribution. And we will continue distributing, and we hope to finish within 2 weeks, reach all the beneficiaries.
Over in Plateau, no fewer than 35,933 households across the 17 local government areas of Plateau, North Central Nigeria, beneficiaries of relief materials also donated by COVID. The materials are mainly food items to be distributed to the vulnerable and indigenous people in the society.
Today's event, the gesture by COVID will definitely extend the frontiers of what we have been doing by reaching other vulnerable persons who did not benefit from the previous efforts. For this distribution, COVID has set out clear criteria for identifying qualifying households that will benefit from the food relief program. Our role as a state is to facilitate this process based on defined guidelines. The items being received today will be distributed by the State Implementation Committee, which comprises COVID monitoring and evaluation team, representatives of the media, representatives of security agencies, and representatives of the State Palliative Committee. This Implementation Committee will further organize for the representatives of all local government areas to collect the allocations for each local government and oversee the distribution to eligible beneficiaries in each ward based on set guidelines and schedules.
Now, after days of recording a decrease in its daily COVID-19 infection, the figure for Lagos rose again, increasing to its highest in 1 week since July 28. Lagos, the epicenter of the virus, had recorded less than 100 new cases in its daily count over the past 1 week. But it has also recorded the highest number in terms of those that have recovered, over 13,000 that have been discharged in the state. Joining us in our studio here in Lagos is Dr. Richardson Ajayi. He is the Chairman, Governing Board, LASUTH, Executive Vice Chairman, Bridge Clinic, Sync Lab, Nigeria. He joins us here. Thank you for joining us on the program.
Thank you very much.
So a lot of people have been talking about the recoveries in Lagos, and we hear that over 10,000 is linked to the home care management. What's your perhaps assessment of the home care model by the state government?
Thank you very much for this question. I think we need to just gain an understanding of COVID as an infection. The people that succumb to this condition are usually the elderly and people with comorbidities, and that has been consistent across all countries. So what that tells us is that a lot of the people that get infected will be fine. So I think the fact that you have COVID doesn't mean you have a death sentence. And I think because most will be fine and will recover, and they need to be supported through that recovery. I think the idea of managing people at home is a very good one. In fact, if you look at the infection rate, when you look at the number of people that have been tested versus the number detected, it's about 15% nationally. Admittedly, our criteria for testing are quite stringent. So if you try and extrapolate that to the population, and say, even if we use 5% for the population of Lagos, we probably have about 1 million people infected, but they're fine. So I think the idea of managing people at home, I think it's a right decision, and it's working very well.
So you have managed a COVID-19 isolation and treatment center. This is to support Lagos State's response. What was the experience like?
I think it was an important thing for us to do. I think sort of late February, a lot of us got talking that this thing is coming. What are we going to do? And we knew that the state had already set up the EOC at that time, and we knew there was talk about setting up isolation centers. IDH was being, uplifted, and we felt that Etiosa needed something, because Etiosa would be perhaps the epicenter, because a lot of people will be traveling back for Easter. And so we got together and felt that the private sector needed to do something. So the organization I worked with is an organization called YPO, Young Presidents Organization. And quite a few people in YPO, could muster resources. And so we decided to approach the state government and put our ideas on the table, and we were well received. We had to build the isolation center to specifications of pharma and leukemia, and assign an MOU with Lagos State to run the isolation center for 3 months according to all protocols of Lagos State. And we set it up. Mr. Governor opened it, and over the 3 months, I think we treated about 320 patients who were admitted in. And it was a fully equipped hospital. We had ICU beds, and we had about 130 staff that we recruited, and it was wholly run and supported by the private sector. The experience was, we felt it was needed. Throughout that period, my phone didn't stop ringing. People wanting to be admitted, people wanting to get tested, and we were very busy. But we closed the facility end of July, which was the plan. And having done that, I think we filled a significant gap in the need. So it was a very, very, it was a good thing to do, very beneficial.
We also understand that there were some deaths that were recorded in the facility. Perhaps you tell us a bit more about that, but we need to go on a break now. We still have Dr. Ajayi with us, and more when we return. Stay with us. Welcome back. We still have Dr. Richardson Ajayi, Chairman, Governing Board, LASUTH, Executive Vice Chairman, Bridge Clinic and Sing Lab, Nigeria. Talking about the isolation center in Etiosa, which you said that is closed at the moment. There were some complications due to that led to some COVID-19 deaths. What were the problems?
Well, we had 6 deaths in the isolation center out of about the 320-something patients we admitted. All had comorbidities. The 3 leading issues: one is the age, second is diabetes, third heart disease, and I think one of them had renal complications as well. So I think it's not just having COVID; it's having COVID and something else that's quite advanced. So we lost six of the patients very sadly, but we gave them all that we could.
So there were no issues with regards to ventilators, the oxygen, all
Oh,
the other
no,
provisions?
we were fully equipped. We were fully equipped. We had 4 intensivists on the staff who are experienced ICU doctors. So we had everything in place to ensure that we would meet the needs of anybody.
What's your take on the Lagos numbers, the trend, the trajectory of the virus in Lagos, and to see that it's also sort of opening up? If you look at other countries, a number of them have opened up, but they're closing back down, locking back down due to spiking cases. Is it too soon? Are we moving too fast, or do you think this is okay?
Well, I think first thing is to just say I would doff my hat to Mr. Governor, our Incident Commander, and the Honorable Commissioner for Health, Professor Abayomi, in the approach. I mean, they've been very, very strategic in terms of decision making. We're locked down at the right time because we didn't know what we were dealing with. But you have to balance that with the fact that most of the people in Lagos need to earn an income. And I think they made the right decision to open at the right time. And we've been looking at the trajectory. And over the last, if you take a broad view of the number of new cases, it's tailing downwards. The hope is that it's not the calm before the storm, but it looks like things have been managed, and our ship of Lagos has been charted through a very turbulent sea. And I think we were dealing with something really, really, really difficult to manage. But I think they've been very tactical and strategic in decision making, and I think it's getting calmer. And I hope we don't get another spike.
All right, lots of optimism from you. Thank you so much, Dr. Richardson Ajayi. Thank you for joining us on the program.
Thank you for inviting me.
Now, it's still a global hunt for the coronavirus vaccine, and we have Professor Igo Ofotokun, a professor of medicine, behavioral science and health education at Emory University, lead consultant, research consortium for the U.S. government on trials on COVID-19 drugs and vaccine. He joins us via Skype. Thank you for joining us on the program.
Thank you for having me.
All right. Now, talking about the race, the global hunt for a vaccine, which potential vaccine would you say is leading in the race?
Well, currently there are many candidate vaccines in development, but here in US, there are 4 potential candidates that are making it into phase 3 trial. The first is the Moderna vaccine that is being manufactured or developed by a company named Moderna in Cambridge, Massachusetts. It has completed its phase 1 study, which was published in New England Journal of Medicine a few weeks back, and the result was very promising. There was robust antibody generation against the SARS-CoV-2 virus. And so that vaccine is now in phase 3, which is the large, big clinical trial to determine safety and efficacy. The first patient, I believe, was enrolled last week, Monday. The goal is for that trial to enroll or recruit 30,000 people across the globe, and hope within a period of 2 to 3 months, and hopefully we would have an efficacy result before the end of the year. The second vaccine that is making it very quickly into a phase 3 trial is the AstraZeneca vaccine, which was developed by the group in Oxford, United Kingdom. That trial is scheduled to start sometime in August. Again, that will be a large global trial that will enroll about 30,000 individuals. Then there's Johnson and Johnson trial that will start sometime in September. It's another big vaccine. And then the Novavax vaccine also, which has shown very promising phase 1 result, will go into phase 3 trial in October. And there's a Sanofi trial, so there's a lot of candidates making it into clinical trials, and we expect that by the end of the year we should have a result from some of these trials. And the initial signal we're getting are very promising, they are encouraging, and we're hoping that they will be this will pan out in the larger clinical trial, that it will turn out to be safe, it will turn out to be effective.
Professor, I wanted to get your take quickly on Russia's reports of positive results from its own trials. Do you think that this is something to take note of?
Absolutely. So this is a pandemic. Every corner of the world, every country in the world is affected. And so in addition to the effort in the West, there are the Russian effort, there are Chinese product in development. I think the last time I looked at the WHO website, there were probably over 150 candidates that are making it through various stages of development. And I think that we would have a lot of product either from the West or from China or from Russia. So I think any candidate that is being reported should be critically taken a look at. Yeah.
I wanted to quickly, if you could, perhaps in a few seconds, we know that countries are really scrambling as well, already securing millions of doses from what is out there and what is promising. But do you see a problem for developing or poorer countries? Are they at risk?
In terms of both the therapeutics as well as the vaccine, there are efforts at high levels to ensure that, first of all, the clinical trials are not only done in the US or in the Western world. Many of these trials are being done all over, with sites in all over the world, every continent in the world. So I know, for example, the Moderna vaccine, the AstraZeneca vaccine, the Johnson and Johnson, and the Novavax vaccine that my group is involved in, they're making an attempt to ensure that the clinical trials are done in the US, in Europe, in South America, in Africa, as well as Asia and Eastern European countries. And there is a team of experts, both within the US, the WHO, that are working to ensure that if there is a safe and effective vaccine that is equitably distributed across all countries in the world.
All right.
And I think all countries will do themselves a good favor to position themselves to begin to inquire about on how to acquire these vaccines or products when they become available.
We appreciate your time. Thank you so much, Professor Igor Ofotokun, Professor of Medicine, Behavioral Science, Health Education, Emory University. Thank you for joining us on the program.
Thank you.
Mozambique has announced another 30 days of emergency in the country in a bid to limit the spread of COVID-19. This is the second time the African nation has declared a health emergency since March, when it confirmed its first case. Vietnam is also taking proactive steps, converting its stadium into a makeshift hospital in case of a surge that overwhelms its health facilities. For more updates, you can take a look at our website. It has the latest updates on the pandemic. All you need to do is log on, channelstv.com. That's the program this afternoon. Thank you for watching. I'm Melissa Tumoka. Stay safe.